Hi, I'm Dr. Bentley, an internal medicine and gastroenterology specialist. So how can I help you today?
Hi, I'm Sarah. I'm 31 years old and I work as a yoga instructor. This is really frustrating for me because I've always been very fit, but lately I've been having breathing problems during my classes. I get short of breath and start wheezing, especially during more intense flows.
That must be particularly concerning given your profession, Sarah. Exercise-induced breathing problems can have several causes. Can you describe more specifically when this happens? Is it during certain types of poses, at a particular intensity level, or in specific environments?
It seems to happen most during vinyasa or power yoga classes where the pace is faster and more demanding. I also notice it more in the heated yoga studio. We keep it around 95 degrees with high humidity. The wheezing usually starts about 10 minutes into class and gets worse as we go.
The combination of exercise, heat, and humidity can definitely trigger respiratory symptoms. This sounds like it could be exercise-induced asthma, which can develop at any age, even in people who've never had breathing problems before. Have you noticed any symptoms outside of your yoga practice?
Not really during normal activities, but I did notice some wheezing a few weeks ago when I was jogging outside on a cold morning. And sometimes I have a dry cough at night, but I thought that might be from talking so much during classes.
Those are additional clues that support exercise-induced asthma. Cold air is another common trigger, along with exercise in hot, humid conditions. Have you had any recent respiratory infections, allergies, or exposed to new irritants?
I did have a pretty bad cold about 2 months ago that took forever to go away. And I've been dealing with seasonal allergies more than usual this summer, lots of sneezing and congestion.
Absolutely. Respiratory infections can sometimes trigger the development of asthma, and allergies often go hand in hand with asthma. We call it the allergic triad. Your airways may have become hyperresponsive after the infection, making them more likely to react to exercise triggers.
This is really impacting my ability to teach. I'm supposed to be demonstrating poses and guiding students, but I can barely breathe myself. Is there anything I can do?
We need to get you properly evaluated first, but in the meantime, try pre-treating before classes with a rescue inhaler if we prescribe one. You might also try warming up more gradually and staying well hydrated.
What tests will I need?
I'll order pulmonary function tests, both at rest and after exercise challenge, to see if your airways narrow with activity. We might also do allergy testing given your seasonal symptoms. An exercise stress test specifically designed to provoke symptoms can help confirm the diagnosis.
If it is exercise-induced asthma, does that mean I'll have to give up teaching yoga?
Not at all. Many professional athletes have exercise-induced asthma and compete at the highest levels. With proper treatment, most people can continue all their activities. The key is identifying your specific triggers and using preventive medications appropriately.
What kind of treatments are available?
For exercise-induced asthma, we often start with a short-acting bronchodilator used 15 to 20 minutes before exercise. Some people also benefit from long-acting medications or anti-inflammatory inhalers for daily control. We'll tailor the treatment to your specific needs and activity level.
Are there any modifications I should make to my teaching style?
Once we get your asthma controlled, you probably won't need major modifications. However, you might consider having students do more of the demonstrations while you provide verbal instruction, ensure good ventilation in your studios, and always have your rescue inhaler nearby.
I'm relieved this might have a solution. I was worried I might have developed some serious lung condition.
Exercise-induced asthma is very manageable with proper treatment. Many of my patients are surprised how much better they feel once we get their symptoms controlled. You'll likely be back to teaching full classes without breathing problems very soon.
How quickly might I see improvement?
With the right treatment, you should notice improvement within a few days to a week. The rescue inhaler should provide immediate relief when used before exercise. Let's get your testing done and create a treatment plan that keeps you breathing easily through even your most challenging yoga flows.
Thank you so much, Dr. Bentley.
My pleasure. Remember, this information is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for personalized medical care.
Thank you for watching Dr. Bentley's Internal Medicine Life-Saving Cases. If you have any medical questions, please leave your comment below. Have a wonderful day.